Okay, our next speaker is Dr. Erik Swartz. He is a professor and chair of the Department of Physical Therapy and Kinesiology at the University of Massachusetts. Dr. Swartz's research interest focuses on the prevention and acute care of head and neck injuries in football. He previously served on the NFL Head, Neck, and Spine Committee's subcommittee for safety, equipment, and rules, and he is now chairing the NATA position statement on acute management of cervical spine injured athlete. Please join me in welcoming Dr. Erik Swartz.
All right, getting late in the afternoon. We're thinning out a little bit. I see some blank and vacant looks out there, so you must have concussions, because that's one of the symptoms, right? So some disclosures here, recent and current funding, and we have a trademark for the term HUT back at UNH. So with this all-star cast here on this document, with the 11 R's, and the 11th R, risk reduction, is really prevention, but it sounded better than having 10 R's and a P at the end. So they call it risk reduction, but it's about prevention. But it's kind of like a rally killer, because here's their summary: is despite a myriad of studies examining sport-related concussion prevention interventions across several sports, it's basically inconclusive because of conflicting evidence. So you'll find that a lot of what I'll present and talk about in here are issues around why it's hard to come up with definitive, strong evidence for, or just the fact that we have a lack of high-level evidence. First, to establish some context, you all know this, but this gets confused oftentimes with then not always just the lay public, but then with the whole environment around sports and with coaches. In particular, is that concussion, head impact exposure, it's a health problem. And I want to reemphasize or reiterate that this is a health problem. And so to solve a health problem with some kind of intervention or treatment coming from some type of medical intervention, how different is that from any over-the-counter drug or prescription drug that you might be prescribed or reach into the cabinet for? So this is children's Advil here. Child has a headache or some aches or pains. You pull this out, and then there's the dosing recommendations. And look how many iterations there are just on children's Advil, dependent on their age and their weight, right? All of that. And that comes about from what? Randomized controlled trials, to determine how much of a dose do you need to actually address the health problem, the headache or the pain, to get a resolution from it. All right, so I want to establish that kind of as an analogy as we walk through then, trying to solve this health problem in sports. And that's in particular in some sports, like in football, when we look at, this isn't concussions just in football, but this is head impact exposure over time. This trajectory is going in the opposite direction that we would like to see. So there are increasing head impact exposures in increasing levels of play, whereas all other kinds of skills or things that we might look at for whether it's football or other sports, we would expect to see improvements, increasing in speed, increasing in whatever it might be. But in football, we're seeing an increase in an undesirable direction for the head impacts that they sustain on a weekly basis. Now, there's a few less exposures per week on the youth levels, but really not that much. Youth football in our area, they're practicing 3 times a week and they have a game on the weekend. So it's really not that much different than on the high school and the professional levels. But what you'll also see is that I'm focusing bit of my talk here on what is the behavior that leads to concussion. And in this instance here, with the picture on the lower right, if you can see that, is that those scars, battle wounds on the helmet for that individual playing football there is really demonstrating a behavior of head-first contact. And that then is what leads to the risk for concussions or subconcussions or spine injury or whatever it might be. So what we generally see kind of lumped into a couple categories when it comes to trying to prevent concussion, trying to address this health problem is any number of different kinds of educations, modifications to the game, rules, regulations, infractions, penalties, whatever it might be, that a lot of which seem to be really effective and have a lot of uptake. The one on the lower right with hockey, I don't know if you've seen that, where there's a stop sign on the back of the jersey so that other players, when they come up to them and the player that they're maybe about to check is facing the boards, they'll stop. They won't check them into the boards to try and decrease that incidence of being checked head first into the boards. But other attempts of whether it's banning heading in soccer, penalizing for targeting. A lot of these, though, not all of them, a lot of these, the behavior happens first, though. In other words, targeting it's a great deterrent, but it's not addressing the behavior itself. It means that somebody has led with their head and hit somebody, and there maybe has been an injury, and it's after the fact. So that's a deterrent or a strategy, but it actually depends on the fact that that behavior has occurred in the first place. And then the other just kind of way that we look at concussion prevention, well, we have this injury to the brain, so let's put padding around it. And that's an intuitive, logical thing to do that they started with football. And in the lower right there, you kind of see the tree of helmets and how they've evolved over time, which we've heard a little bit about today. And other thoughts, again, just making intuitive sense. Well, let's put more padding there. Let's add padding in soccer. Let's add or change or improve the design of certain helmets, whether it be in lacrosse or football. The upper left, that's in boxing, that one there. But again, to establish a solution for a health problem, and when it comes to injury, concussion being that injury we're focusing on here, is that, and as Zach mentioned earlier, this approach for injury prevention, the TRIP method for injury prevention, really important that first we identify what the mechanism is, what's causing the injury. I do like to think about spearing in football. When that became an issue in the 50s and the 60s, early 70s, that was identified through very basic observational studies. They eliminated or tried to came up with a rule for spearing in football, and that had a dramatic decrease in catastrophic injuries and fatalities in football. And so they did that, but a lot of the other efforts that, whether they're educational or modifications to games or rules changes, would kind of come up with this solution, but then oftentimes it stops there. This step 4 of this TRIP model for injury prevention is that you take those ideas, right, those measures, and then you are really to study them, have scientific evaluation in ideal conditions. But go back to talking about football helmets or other types of things that we might put on the brain. Yes, in the lab, it's going to decrease head impact forces, but does it really result in a decrease in concussion? Is it solving the health problem in reality on the field on human beings? And then that understudy, implementing the intervention, but then continuing to monitor or evaluate that to ensure that it's actually doing what it's intended to do. Oftentimes that's not happening, but I have some examples of where it has happened. And that going back again to this concept around just the culture, the environment around safety in sports, or head safety in particular, that we're focusing on here, there's a lot of factors going on in here. There's a lot of dynamics, interpersonal, intrapersonal dynamics that are happening between coaches, parents, officials, players. That's a really complicated system to be able to try and influence when it comes to trying to prevent an injury. And that in some sports, like football, it has really this kind of like sphere around it where if you're not of the cloth, if you're not a card-carrying member, you sometimes aren't really, there's a lack of credibility as to whether or not an idea really would even gain traction. The culture in football and other sports as well for how they learn to do it better with their program is often to just look to the higher levels of the sport, to higher performing or model types of programs, and learn from them as kind of the soup du jour. What are they doing to be successful? Then they turn around and they try to do it with their program. So that's kind of the model of how a lot of sports, but particularly in football itself, where they seek out what they might do with their own teams and programs, but then oftentimes they'll even adjust it themselves and tweak it to what they think is best. So some more context is this notion of risk compensation. So whether it's rules or modifications to a game or protective measures like protective helmets that are introduced to a sport or perhaps improved designs or materials, is that there's a possibility that exists that you end up trying to protect one thing or address one problem and you create other problems. Again, going back to football, the best example there again is with spearing. So in the 50s and 60s, when the helmets got better, you then had players spear tackling. That wasn't really evident before because their heads weren't protected. So this is an area of study called risk compensation or risk homeostasis. So to get into that a little bit more, and if you've seen me present in the past, I've admitted to the audience that I have a fear of heights. And so this type of behavior here, like I wouldn't do this. I perceive that to be highly risky, and there's no way you would find me doing that. Is not me. I don't know who they are. I just know they're out of their minds. They're sitting on that ledge, and I'm pretty sure it's not doctored, but I would not do that because I'm afraid of heights. So my perception of that would be that I would not even be anywhere near that. And so the image, again, that's not me on the right. I wouldn't even be the person taking the picture of the person taking the picture. Who does that? But he's doing that there. But look how close he is to the edge. No way I would do that. So the risk factor, let's say on the blue there, is a relatively medium to high kind of risk factor as far as I don't feel safe. It may be that threshold for taking that risk has not been exceeded. And so for this individual there, that risk factor does not exceed his risk threshold, no problem going right up to the edge and taking the picture. So for me, I would go closer to an edge if there was a railing there, so there's a safety measure there. So that's a countermeasure, right? To make the edge there safer. But what it's done is it's changed the behavior. I would go closer to the edge because that railing is there. And that is the manifestation of what we assume happened here is that the person got close to the edge because the railing was there and they fell off and got hurt. And that risk compensation would suggest that if the railing wasn't there, the person wouldn't have gotten hurt because they wouldn't have gone as close to the edge as the railing allowed. Does that make sense? And also, again, I just found this picture. I didn't take it. I didn't watch somebody fall off the cliff and then think about, ooh, this would be good for my presentation. I found this, all right, but it made sense. So when it comes to football, and I'll come back to this with my own research in a little while, risk compensation is that the football helmet, that protective measure, enables head contact during play because of the protection it affords. The helmet is necessary. Have to have it in the game the way the game is played today. But it also brings this other component to it, is that it also contributes to that behavior. And if we just look at how helmets are kind of marketed, how they're perceived, how they're held kind of revered by the industry, by the football industry. We have the model right out there, number 23 with the Michigan gear. The visor, it's tinted, it looks cool. It's got like a Darth Vader kind of vibe to it, so the players are like, oh man, I'm going to be an animal out there on the field. And so that concept, and by the way, the one on the left, if you're familiar with it, that's that flex helmet, speed flex helmet. That panel right on the front, that will flex. And yes, that decreases the impact forces a little bit, but that's also the area of the head that we don't want the player using. Yet there's this added measure of protection right there. So does it help enable the behavior as much as it helps to mitigate it? So with some other sports then, if we think about in girls and women's lacrosse, the idea to introduce head protection, whether it be soft or rigid helmet kinds of combinations to protect girls or women during play in lacrosse. There was a study where they were tracking injury rates for 3 years in Florida, compared it against, during the same time frame, boys lacrosse. And injuries, overall injuries and concussions, increased in girls lacrosse during those 3 years after that head protection was mandated, whereas there was no change over that time in boys lacrosse. So did it influence their behavior? For this video here, listen more to what is being said as opposed to what is being shown.
We found out that other teams had helmets. We got the option to get helmets, so if we play a team who's got a helmet, we decided that we would play our helmets against their helmets because we didn't want to have the option to be, I thought it was kind of going to be used as an intimidation factor more than a safety. So that's why we decided to get the helmets. We didn't want our team to have any kind of a disadvantage because we thought that if we play a team who has a helmet, we go for a ball, they go for a ball, and they hit us in the head. Next time my kid's going to be like, oh, I'm not going to go in for a ball, so that would be a disadvantage for us. Girls hate the helmets. And not that they hate them only because they're uncomfortable right now. They have these two things that push into their head.
What is going on there? Just think about the complexities of what is happening by introducing that, and this is in Long Island where it was like an option. So they purchased helmets, but we're only going to use them when the other team was using them, and not for necessarily for safety purposes, because it was a disadvantage to winning the competition. So change, and when it comes to prevention in sport, requires involvement at multiple levels. And this sport aspect, and in particular some sports like football, can be really difficult to kind of pierce that sphere around it. We have some great examples, hockey being one of them, body checking in Canada on the Pee-wee and Bantam levels, where research was done that showed that, yes, there was a higher rate of concussions on those Pee-wee levels where body checking was allowed versus where it wasn't. But they also followed this rule change, and in different provinces looked at the next level up, Bantam players, those that had body checked on the lower levels versus those that didn't have body checking on the lower levels. And it was those players that didn't have that body checking experience that then had more injuries or more severe injuries once they got into that body checking level. Now, despite that, they still banned body checking because overall, the costs and overall impact of concussions on the lower levels outweighed the possibility that then those players that weren't body checking weren't like learning how to do it and then were more susceptible to injury once they got into that higher level. But we like how we're seeing societies or organizations really emphasizing an evidence-based decision to put brain safety first. Recently in rugby, they had a trial where they were lowering the level of tackling. And so in the Rugby Football Union, instead of the rule in rugby where it is you cannot tackle above the shoulders, it was they were trialing a change where you could not tackle above the armpits. Now that's not that much of a difference, but at least it's like a visual cue for the tackler to kind of see. I'm no longer staying below the shoulders, now I got to stay below the armpits. They stopped the trial early because of an increase in concussions, because they felt the ball carriers were going down and the tackler was bending down further, and they were then colliding with each other and having some head-to-head contacts, and the concussion frequency actually went up. So they stopped that trial early. And the interim director of the RFU says we are committed to an evidence-based approach to injury prevention. So it's great to see examples like this that are happening. This is those later aspects of that TRIP approach. A recent study out of Wisconsin, now that headgear in soccer has been a concept that's been around for a while. The conclusion here, the title of the article, protective headgear does not prevent sport-related concussions in soccer players. So a pretty robust population, 2,700 participants, no difference in sport-related concussions between those who were randomized to wearing headgear and those who were not. And we think about the amount of money that was used to purchase these, and they didn't have an effect, at least with respect to concussions. But you'll notice the top is just cropped an image from Virginia Tech has helmet ratings, and they're doing headgear ratings as well, and even including soccer, so that at least the public has some, somewhere to go to find out which are better. But they're thinking that they're doing this because it's going to prevent concussions. So how do we decrease head impact exposure, concussion, the injuries that come along with that in the sport of football? This is, again, just to maybe illustrate a model or kind of a consensus. And what you have here is that there's going to be an update to the NATA position statement for head first contact in football. Originally, it was more about spearing and preventing spine injuries, but we're kind of readjusted the objective to get right at the kind of the behavior of head first initiated contact to try and reduce concussions, head impact exposure, spine injury, whatever may be coming from. Kind of the root of the problem in this respect is the behavior of head first contact in football. So I have some of the draft recommendations. These were not in your handouts though. The NATA doesn't always like us to put out recommendations before they've been published, so that's why they weren't in the handouts. Didn't want them, getting out there too much. So it's a good thing this isn't being recorded or video streamed live to the world. So it's just a tight, intimate group here. So I know I can trust you. So these draft recommendations at this point for this position statement fall into these different categories. So I've pulled a few examples for you. Thinking about that environment around head safety in sports, particularly in football, really trying to take an interprofessional approach and collaboration for people to work together to try and address head first contact behavior, particularly in football. This is not new, but one of the recommendations will be that, yes, restricting the number of allowable full contact practices per week or that time is important, but what we want to emphasize is that we do not want to compromise skill development and mastery. So taking something away decreases the opportunities for head impacts, but taking something away may also decrease the opportunity for learning, mastering, and maintaining an important skill. The NFL, maybe you saw, recently announced that they were going to eliminate certain drills that were known to be lead to head-first behavior or reinforce head-first behavior. So that would be likely a recommendation. And probably the most important part in here is that we'll have some recommendations around skill instruction and development of those skills for tackling, blocking, and going into contact situations. There's a couple examples here that are in the literature, but if you see that the recommendations here are really trying to get at an evidence-based, progressive techniques for avoiding head-initiated contact during all opportunities for contact in tackle football, and that mastery and reinforcement of those skills need to happen at the first exposure to tackle football and throughout all levels of play. And there's been some research on that Zach has been involved in a lot on the USA Football heads up tackling technique, which has been around for a while. And it has some evidence that it could decrease head impacts, decrease concussions perhaps when paired with other approaches like contact restrictions. But there's been some other nuances with this that maybe aren't working out so well. Like they're not yet reporting that there's an influence on game rate concussions during games. And there's this model for a player safety coach where some of the research is showing that the coaches who are supposed to be designated as a player safety coach to help carry out these this model for heads-up tackling are not attending the clinics and are not really around or present. We've done some research on helmetless tackling, kind of inspired from rugby, but not a rugby tackle per se. It's rooted in the fact that having someone practice tackling without a helmet on is going to leverage the vulnerability that they would naturally feel and then keep their head out of the way when they go into contact. So we did a small study at University of New Hampshire. Throughout the course of a season, we saw that head impacts per exposure went down in the treatment group, but they stayed the same for the control group. We have a study where then we went out to high schools. We went to 4 high schools in southern New Hampshire. We had over 100 participants, again, randomized to the control or to the treatment of helmetless tackling training, kind of on a weekly basis, drills that were done for discrete periods of time. We built an app for coaches to use. We had research assistants present at the field. We recorded head impacts every single day for games and practices. And it wasn't as profound as it was in the college study, but we're seeing some change, temporary changes, where we had a decrease in head impacts per exposure in the treatment group versus the control group during games here. And then we also did it by location, and we saw that we decreased head impacts at the front of the helmet, which is a positive benefit. A couple notes here just about the technology. There was a question that was raised before about head impact monitoring. We'll likely have a recommendation around that head impact monitoring systems can assist in identifying and correcting head-first contact behavior, but the technology should not be used to diagnose a concussion or replace a healthcare professional. And it was raised that this technology isn't perfect. It comes with limitations. Here's an example of a head impact that we collected at UNH, and there'll be a couple views here. During a kickoff return, where clearly it was not UNH's fault, it was the other team, put his head down, came over, and they had head-to-head contact. Both players, by the way, were knocked unconscious for a little while. One more quick view. All right, well, you don't really need a system to tell you that there's likely a concussion there, but that was over 150 Gs as measured by this system, but it was identified as a clack, meaning it thought it was a false impact. Because whatever algorithms they had behind it to identify the frequencies, the characteristics of the linear frequencies and rotational frequencies, maybe just didn't match closely enough. And if we hadn't seen that, like it categorized that as not being an actual true head impact. There's another example here. You've seen these hits. Similar impact magnitude, 150 G. It did correctly identify it. It had the wrong location of the impact. But because I'm running out of time, I want to get through this quick. There same impact magnitude. The first example you saw, the player was knocked unconscious, had a concussion, returned in about 10 days. The player here, no concussion, no symptoms, no problems. We will have recommendations surrounding helmet add-ons that at this point, aftermarket helmet add-ons are not going to be recommended. I have that picture there, the upper right of these young boys playing football. You know, look how many times the size of the contact area there now is based on what their actual head size is versus now they have the helmet and then they have these like twin mattresses like strapped to the top of their helmets. Yes, that will decrease force, but it also increases contact area. And again, does it continue to perpetuate that behavior of having the contact or having your head go into contact. And that we will likely have recommendations around how these kinds of things are marketed or portrayed. Here, a lot of this is really on the right is more on how the media is depicting this. Well, here's an 8th grader who created a life-saving helmet. The teen's helmet decreases concussions. Did that 8th grader conduct a randomized controlled trial in order to come up with that? Probably not. And that we'll have a recommendation surrounding the importance, again, of generating high-level scientific research, because really it's poor at this point. High-level evidence-based research for concussion prevention strategies. So in conclusion, head impact exposure, concussion, it is a health problem. It requires high-level study to demonstrate or validate resolution. There's a critical need for strong evidence, and that preventing concussion in sport requires involvement at all levels of the community. And helmets are sometimes really important, like when you're snowboarding or skiing, you really should have a helmet. So I don't recommend helmetless skiing or snowboarding. Thank you.